Okay, good afternoon, folks. This afternoon's topic is neurotechnologies designed to help with brain disorders. So we'll discuss that tonight or this afternoon for A. Please join me in today's presentation A for y'all. Okay, here we go. This study explores how the public perceives various neurotechnologies designed to treat severe mood, memory, or motor symptoms. Researchers surveyed over 1,000 US adults to gauge their views on four specific innovations: deep brain stimulation, or DBS, MRI guided focused ultrasound, or MRI GFUS. And then there's traditional medication pills. The study, published in the journal Device, aimed to understand how symptom type influences public acceptance of these treatments. Participants rated each neurotechnology based on its perceived benefits, risk, and acceptability. They also considered whether these treatments might after a whether these treatments might alter a person's identity, and whether they would personality use them faced with severe symptoms. The study findings revealed varying levels of openness, with pills being the most widely accepted, 61%, followed by TMS, 41% by MRI GFUS, 29% and 29% and 21% DBS. The study was conducted as part of the Neurotech Justice Accelerator at Mass General Birmingham, which a Dana Carter for neuroscience and society, which seeks to better understand public attitude toward emerging neurotechnologies. Okay, deep brain stimulation is a medical procedure that involves implanting electrodes in specific areas in the brain to deliver controlled electrical impulses. These impulses help regulate abnormal brain activity and can be used to treat various neurological and psychological psychiatric conditions. Next page. Now I'm going to explain how it works. Okay, guys, DBS consists of three main components: electrodes, electroleads implanted in targeted brain regions, pulse generator, a small device placed under the skin near the collarbone, similar to a pacemaker. Okay. Extension wires connected to the electrodes to the pulse generator. The pulse generator sends electrical signals to the brain, modulating neural activity and alleviating symptoms of certain disorders. Okay. Now we're going to go through conditions treated, guys, with DBS. Okay. DBS is commonly used for Parkinson's disease, helps manage tremors, stiffness, and movement difficulties. Okay, that's one. Okay, essential tremor reduces involuntary shaking in Parkinson's. Dystonia improves muscle control. Epilepsy helps reduce seizures. Obstructive compulsive disorder, OCD, used when medication is ineffective. Researchers are also exploring its potential for treating depression, Alzheimer's disease, addiction, and chronic pain. What is purpose and procedure? Okay, now this next part that I attached, guys, comes from Cleveland Clinic. Okay, so I'm going to read some more information for you, but I spliced them together in one report. So give me a minute. Okay, this one, like I said, comes from Cleveland Clinic. Okay, .org. Procedure and risks. The surgery involves placing electrodes in the brain through small holes in the skull. The pulse generator is implanted under the skin. Okay. Okay. In the chest, while DBS is generally safe, risks include infection, bleeding, stroke, and hardware complications. Deep brain stimulation, or DBS, is used to treat a variety of neurological and psychiatric conditions, particularly those involving movement disorders or treatment-resistant symptoms. Some of the most common conditions it can help include movement disorders, which is Parkinson's disease, guys, and tremors, stiffness, and movement difficulties. Okay. Now we're going to break those down for you. Essential tremor reduces involuntary shaking, especially in the hands. Dystonia helps regulate abnormal muscle contractions and improve movement control. Neurological conditions. Epilepsy can help reduce the frequency and severity of seizures. Okay. Tourette syndrome, used experimentally to manage severe tics in Tourette's, folks. Psychiatric and mood disorders. Obstructive compulsive disorder, or OCD, for cases where medication and therapy are not where medication therapy are ineffective. Okay. Treatment resistant depression and investigated for cases where other treatments have failed. Okay, other potential uses. Researchers are also studying DBS for conditions like Alzheimer's disease, chronic pain, addiction, and post-traumatic stress disorder. Okay, let's see. Through these applications are still experimental. Deep brain stimulation is a surgical treatment that helps manage Parkinson's disease symptoms by delivering electrical impulses to specific brain regions. While it doesn't cure Parkinson's, it can significantly improve movement related symptoms and enhance quality of life. Okay. How now we're going to get into how DBS helps. Reduces tremors. DBS is highly effective in controlling tremors that don't respond well to medications. Parkinson's disease. Okay. And then this comes from Parkinson's Disease Foundation, folks, this information. So, okay, then you get into treatment options. DBS, or deep brain stimulation, involves motor symptoms. It helps with stiffness, slowed movement, and dyskinesia. Okay, involuntary movements caused by Parkinson's medication increases on time. Patients experience longer periods of symptom relief between medication doses. Enhances daily function. Many people find they can move more freely and perform daily activities with greater ease. Parkinson's Foundation. Okay, Parkinson.org, guys. Let's see. Okay, how it works. DBS involves implanting electrodes in the brain areas responsible for movement control. These electrodes are connected to an impulse generator, which sends electrical signals to regulate abnormal brain activity. The stimulation helps restore more normal movement patterns. Give me a minute, guys. I'll explain that too. Okay, conditions that this helps. DBS is most effective for people who experience severe motor fluctuations despite medication. However, it may not improve symptoms like speech difficulties or cognitive decline. Parkinson's disease, Parkinson's Foundation. Okay, like any surgery, it comes with risks, such as infection, bleeding, or changes in speech. Would you like to know more? Would you like to know more about the procedure or its long-term effects? Okay, guys, I'll be right with you. Give me a minute, please. Okay, deep brain stimulation has shown long-term effectiveness, particularly for movement disorders like Parkinson's disease. Studies indicate that DBS can remain beneficial for over 15 years, helping maintain quality of life. Okay, then you go into long-term benefits of DBS. Sustained symptom relief. DBS continues to reduce tremors, rigidity, and dyskinesia even after a decade. Improved daily function. Many patients experience better mobility and independence compared to those relying solely on medications. Reduced medication dependency. DBS can lower the need for Parkinson's medication, minimizing side effects. Okay, considerations. While DBS remains effective, some symptoms like balance, speech, and cognitive decline may progress despite treatment. Additionally, the battery life of the neurotransmitter varies with rechargeable models lasting up to 15 years. Some recent studies confirm the long-term effectiveness of DBS, particularly Parkinson's disease. Here are some key findings. A 15-year follow-up study published in Neurology found that DBS remains effective in managing motor complications and reducing the need for dopamic drugs. Patients remained significantly symptom relief within 75% reduction in dyskinesia and a 58.7 decrease in off time. Okay, another study in the Journal of Neurology, Neurosurgery examined 10-year survival rates for Parkinson's patients who underwent DBS. While DBS does not halt disease progression, it provides durable symptomatic relief, allowing many individuals to maintain daily activities. These findings suggest that DBS continues to offer long-term benefits as Parkinson's progresses. Would you like details on how DBS compares to other treatments? Okay, guys, that was it for you. Give me a little bit and I'll be back on with B for now. Gator Wellness. Take care, folks. I'll be back on shortly.